Hi, I'm Colleen Hutchinson. We are at the 18th Annual Minimally Invasive Surgery Symposium at the Wynn Encore Las Vegas. I'm here today with Samer Mattar, who currently serves as MBS President. Samer, thank you for being here.
I'm happy to be here.
Can you tell us a little bit about yourself?
Sure. I'm a bariatric surgeon. I'm currently practicing at Swedish Medical Center in Seattle, Washington. I've been doing bariatrics ever since I finished my training. It's been 18 years now. My practice is 100% bariatrics.
Okay.
And I think I have the most rewarding and satisfying job in the world.
We had Dan Schauer here this morning discussing his research on weight loss and
Yes.
cancer rates.
Very exciting.
It's an interesting time to ask the question, where do you see this profession of metabolic surgery heading?
Yes, that's a great question. So there's no question that we can't anymore live alone in a bubble or an island as surgeons. We have to not only subscribe, but also fully live the concept that we are part of a continuum of care. Our patients cannot benefit from surgery alone. The metabolic dysfunction, if you will, or metabolic disease is a multifaceted, very multidimensional problem that requires a truly multidisciplinary approach, whether it's lifestyle changes or pharmacotherapy or surgery, and then support, just like a cancer patient or a transplant patient. And so we need to start thinking of ourselves as part of a continuum of care and work collegially and collaboratively with specialists from other disciplines working towards, supporting the patient, who will be always at the center of this team.
What are your thoughts on the hot topic of gastric bypass versus sleeve?
So I know there's a lot of debate on, which is more superior, which is
Yeah.
more effective, which is more durable, which is safer, and all that. And I would just like to just tell all our membership and all stakeholders and everybody to just calm down a little bit. They're both good operations.
Right.
They both have their place, and they both have important positions within the continuum of care, within the options, within the portfolio of options that we can offer patients. One doesn't necessarily need to be superior than the other. Each patient has her or his own particular operation that works best for them. Perhaps we're not so smart that we can accurately match a patient to an operation, but we need to understand that they all have their place, and we shouldn't try and represent one as superior to the other, because that serves no purpose.
Yeah.
I think we need to be happy and very satisfied that we have a portfolio of options that we can, whether it's the balloon or the sleeve or the band or the bypass, these are all modalities that can be used to serve our patients.
Yeah, one really need not cannibalize the other.
That's right. Nobody wins.
Yeah.
when we have schools or polarization of members according to what operation they feel affiliated to.
Now, you mentioned the balloon. Now that that is a part of the bariatric surgeon's armamentarium, I'd like to know your thoughts on it and its implementation for the bariatric surgeon and general surgeon.
Sure. So as I mentioned, the balloon is one of the options that we can offer our patients. It's part of the continuum of care, part of the portfolio, and it has its place. As you know, around the world, more than 300,000 balloons have been placed, and there's no question that this is a safe modality for our patients, and it has its place. Now, again, when we go back to comparing different procedures to each other, that does not serve purpose. In other words, we shouldn't be comparing the balloon portfolio or profile rather, with the sleeve or other more complex operations. It doesn't make sense, and it's not meant to be compared in direct comparison with these other operations. It has its own indications, its own BMI group, if you will, and its own patient profile. And so it's, again, one of the options that we can serve our patients, and the more options we have, the richer we all are.
Yeah, it's just improved that armamentarium and given one more option.
Yes.
Well, thank you for being here today,
You are
Samer.
very welcome. Thank you for having me. Appreciate it.